Hello everyone, welcome back to Dedicated Dentist, where we probe dentistry 32 reasons why. So far, we discussed descriptive analytical epidemiology. Make sure you watch those videos of case control and cohort before we move on. So, this video will be discussing about experimental epidemiology, also called as interventional study. This is specially used for testing vaccines or drugs, evaluating therapy, or for the assessment of risk factors. This is like cohort study, except that here we are doing randomization, and here the investigator can interfere, like they can add or remove the etiological factor. So that is why it is called as interventional study. So various types of the experimental epidemiological studies are RCT. Now this is the gold standard. Whenever there is any clinical research, this is the gold standard for those studies. Then field trials, community trials, and clinical trials. We start off with a group of population. We select a sample from it, and then we divide this population into study group and control group. Study group is the one to which we can intervene or interfere, that is, we give vaccine or apply a therapy or maybe expose them to a risk factor. But here the risk factor can be controlled, unlike the cohort study. And in control group, we do not give any vaccine, or we give placebo. Placebo is like a drug, but it doesn't have an active component like that in drug. Then we do the follow-up periodically. Then we compare the incident rates of this. If the difference compared is more, then we can say that the vaccine or therapy is effective or is better. Like we had steps in case control and cohort study, we have steps in conducting RCT. First is drawing up a protocol or a plan that signifies the aims of objectives of our study, size of sample, criteria, treatment applied, working procedures and schedule, cost and everything. So we have a protocol with us. And then second step is selecting a reference population or and experimental population. So reference population, also target population, that is the population to which the findings of the study are applied. Say we have a vaccine and we have to test its efficacy, so we'll give this vaccine to the study group or experimental group. If we get positive response, if it is effective, then only we'll give this vaccine to the target population. Then the experimental or study population, it is derived from the reference population and randomly chosen. So they have the same characteristics as reference population, and when this study population it is selected, the members they participate, but it is must to obtain an informed consent from them, and they should be susceptible to disease. Then comes randomization, the heart of this study. It's very important. After we have selected population, now we'll divide them into the study and control groups through randomization. So it's a procedure by which participants are allocated into the groups, that is study and control. Control is not like that in the case control study, but it is just used to do the comparison. So it is a very important step of RCT, and this randomization is done randomly by using table of random numbers, say by the date, odd and even numbers, or their hospital records, or the date of admission of hospital. So random allocation that gives random and equal chance, equal and known chance. This is very important, and you must mention this in bold letters in your answer. Equal and known chance, so everybody will get a chance to participate in it. Like there won't be any bias. This is important. Say we are acquainted with a person, so it's not like we'll put him in a control group. So no, everyone have this equal and known chance. So this way it helps to eliminate bias. So because of randomization, we can eliminate bias, selection bias. That is, if we are, like I said, acquainted with a person and we put him in a group that we desire, so that is eliminated. And also, we can eliminate this bias on the part of participants if they know they belong to study group. Participant bias, or bias because of observer, if he or she knows that he or she is dealing with the study group, that is observer bias. Or bias because of investigator, when the investigator knows that he or she is dealing with the patient who is in the study group. So in order to prevent this technique of blinding is adopted. So bias is eliminated by blinding. The reason why blinding is important is, say the investigator is aware that the participant he's investigating is has been taking placebo or is in the control group, then he might not investigate him properly and might deduce his observations that way, so that will affect the study. Now, you must mention these points in randomization. It eliminates bias. This is very important, and it allows comparability, and every individual gets an equal chance. Also, it eliminates confounding factor. We already discussed this in one of my videos. It's a factor that is associated with exposure and disease. So equal chance, like say again we are acquainted with a person and we might put him in the group we desire, so to that can be eliminated by randomization. And comparability is, say we want the group with the same characteristics, like in case control study we had cases and controls and they had same characteristics of variable like age, sex, class, occupation. Similarly, we have two population, and then when we do randomization, that is like mixing them up, and then we have known and unknown factors or variables that are matched by randomization. In case control studies and all, we were doing matching, but matching is only done when there are known factors. We only match known factors, and we take the characteristics that are desired for the outcome of disease or that will influence the outcome of the disease. But here we have known and unknown factors, and we want to have equal characteristics in both these population. So that is why we make them comparable, that is equal and combined variables or characteristics. And this way, because of randomization, the characteristics these are distributed equally in both the groups. Next is manipulation or intervention. So in this study, we manipulate by either application or withdrawal of the risk factors, say smoking when you are studying lung cancer or its association with smoking. Then follow up. Now this is very important. Examination of both the study groups should be periodically done till the outcome of the disease. Now there will always be some losses or dropouts from the study, and these are inevitable, unavoidable due to death or migration, and this is known as attrition. This is very important term and is asked in vivas. Then the assessment. After we have outcome, we do the assessment. Positive response or result, that is there will be reduced severity of disease. Negative result, there will be more adverse effects, side effects, and even death. There are two types of or study designs of RCT, that is concurrent parallel, which we already discussed, and crossover type of study, that is we will do a crossover. So in this, the participant, they will get the treatment for a period of time, and after a period of time we will stop the treatment, because now we will shuffle or switch the groups, that is control group will now be study group will now be control group, vice versa. And the group that which was receiving placebo will now get the vaccine, and the other group which was receiving vaccine will get placebo. So that's how it is done. So there are various types of randomized control trial, like clinical trials for the drug, preventive trials, risk factor, cessation experiments, and trials of etiological agent, and evaluation of health services. And you must begin your answer with this. We derive the experimental population from reference population, and then we divide this population into the intervention group or study group and control group. Then we do the outcome, and of course there will always be iteration or losses to the follow up. So you must draw this in your, if you get an LAQ on this. And yeah, that was all about RCT. I hope you liked the video.